This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
For at least 70 years now, antibiotics and similar drugs have been used to treat patients with infectious diseases.
But that's the thing. Some of these drugs have been used for so long and used so much that they're now no longer as effective in fighting off the same infectious organisms that they were designed to kill. According to the CDC, each year, at least 2 million people become infected with bacteria that are resistant to antibiotics, otherwise known as superbugs. At least 23,000 people die as a result of superbugs. One of the most common threats the medical community is trying to fight is MRSA. The CDC says MRSA can cause illnesses ranging from skin and wound infections to pneumonia and bloodstream infections that can cause sepsis and death.
And if you've been watching or reading the news over the past several weeks, you've seen that superbugs are infesting hospitals throughout the country like Cedars-Sinai and UCLA, as well as facilities in North Carolina. And while the news of these superbugs in these hospitals is new, antibiotic-resistant infections in medical facilities are not.
So joining us today to tell us how at least one Delmarva hospital is trying to keep patients and visitors safe is Dr. Chris Snyder, who's the Chief Medical Informatic Officer and Hospitalist at Peninsula Regional Medical Center. Thank you so much for coming in today.
Thank you for having us.
So let me start off with a superbug thing that seems to be impacting hospitals. What's your take on this?
Yeah, it's something, this isn't new. There's new strains coming out. Obviously the antibiotic history that was described is clearly changing the way. And you gotta remember, bacteria and viruses are animals.
Right.
So we put coats on when we go out in the winter. They mutate in order to fight antibiotics. So there's a mutation that happens in their DNA, and it becomes resistant to certain antibiotics, penicillin, for example.
Okay.
So. Now, whether people realize it or not, this week is National Patient Safety Week, and this year's theme is United in Safety. What does that mean for you?
That means keeping people, obviously, who are ill safe. So there's a lot of things that have gone on at the hospital in the last few weeks, also associated with flu season, that are related to having the amount of exposure limited to the patients that are in the hospital. And we've talked about a few times, and hand hygiene is always one of those great things that we're not real good experts at. The healthcare industry in itself needs practice at it, but the community at large, again, is challenged with that.
Simple hand washing.
Simple hand washing.
I was going to ask you, what do you think some of the biggest areas of concern are when it comes to patient safety?
Probably one of my biggest areas that we see problems with is medications, medication history. As a doctor, that's probably a gold mine for us, is to have a nice medication list that's complete and accurate.
Right.
We share a lot of that information, and the basis of the medication history is that it identifies problems. So as a medical person, having that medication list could be a missing link for what your problem is, because unfortunately a lot of our medications cause problems in healthcare.
Right.
So what is PRMC's plan to overcome these problems?
So we have a lot of things. We have intake processes we've changed. We have awareness for infections, for example, limiting visitations. And a lot of folks get frustrated with that, but we're doing it to protect loved ones, not necessarily to chase you away. We love visitors.
Yeah.
We want folks there to help their family and loved ones get better, but bringing a 2-year-old with a runny nose into an elderly person's room is a little bit dangerous.
You know, I was going to ask, you're talking about everything that you're doing from PRMC's standpoint, but what about us, the patient, the visitor? What do we need to keep in mind?
Yeah, so one of the biggest things, especially with the medication problems, is keeping an accurate list. You know, every April 15th we are required to do our taxes, right? Or we get penalized. Honestly, I think this is probably something that people don't realize how important it is keep your medication administration up, because I can prescribe you stuff, but I don't know when you've put it in your mouth. So keeping an accurate list of when you take things, documenting it for us, so in those emergent situations we're not scattering around and trying to figure out who's on first when it comes to medication. So it's very important to have that list available and accurate.
So there's plenty we can do to help the hospital, correct?
Most definitely. Well, it's actually helping yourselves, because the more information we have, the better off you're going to be as a patient. When we're working in a dark closet, it's challenging. One of the things we have at the hospital that's classic is palm readers, and a lot of people don't realize when you get registered at our hospital, we actually have a device that reads your palm as a fingerprint and identifies you for registration. So there's some value in having that specific information available to you, and every human's unique, so it's important to have that information.
Okay, knowledge is power. What is the biggest thing that we can do to help?
Well, if I can't beat it enough, I think that medication history really is important.
Right.
I praise patients and their loved ones when they bring them in with a medication list that's complete and accurate with administration times. That's probably one of the #1 things that we have challenges with in our reconciliation of medications is knowing what your meds are. It's very, very important. Everything you put in your mouth over the counter, or if I prescribe it, probably has the largest value to your health care that you can help us with.
And hand washing's right up there too.
Absolutely.
We can't say that enough, can we?
No, we can't.
All right.
No.
Yep.
There it is.
Thanks, Doctor.
Not shaking hands.
Thank you.
So much, Dr. Snyder. And if you would like to learn more about the superbugs or what PRMC is doing to protect you, visit our website, wboc.com. Click on our picture at the top of the page.
Well, from superbugs to Ebola, hospitals and their staffs are often in a race against time when it comes to saving a life.
And sometimes the best source of help can come from the most unexpected place.
A team of bioengineers at Johns Hopkins University recently put out a call for action. They needed experts to help them in a design challenge to quickly build a better Ebola protection suit. They were anticipating responses from virologists, public health workers, nurses, doctors.
But it was a couture wedding dressmaker right here in Maryland who may have given the team the edge they needed to succeed.
Isn't this fabric sumptuous?
Every day, Jill Andrews works with fine silk, chiffon, and French lace.
I've been designing wedding gowns for about 20 years.
Jill loves helping brides look their best, but recently the veteran fashion designer put her skills to new use.
Now I'm working with Tyvek and Velcro and plastic.
Jill volunteered to be part of a team at Johns Hopkins University, building a better suit to protect healthcare workers from Ebola.
I have 2 very close friends that are from Liberia that have sisters that are actually living in Liberia, so I had a direct personal connection.
Students at Hopkins Center for Bioengineering, Innovation, and Design studied current protective gear.
When you're taking it off, is it more likely to fold out or fold in?
The goal is to keep the suit from touching a worker's skin as he removes the gear. Engineers would brainstorm, Jill would create.
We're working on the hood design, and so we could sketch these out and she could kind of put something together, say, is that what you mean?
For some, there's a huge gap between fashion and function, but Jill sees the similarities between both.
It's the most important garment that this person's ever going to buy, and that's really important to me. If this helps save one life, if this makes one person's job or day a little bit easier, that's exactly why I'm doing it.
And the Ebola suit prototype designed by the Johns Hopkins team is one of 5 projects selected in December to receive federal funding through the U.S. Agency for International Development. Now, the exact amount of the funding has not been released just yet.
And in addition to doing a better job of keeping healthcare workers from coming in contact with contaminants, the suit's expected to keep the wearer cooler, which is a huge benefit in humid regions like West Africa.
I bet it is.
But sometimes you don't have to come in contact with contaminants to get sick.
And sometimes you just need to take yourself out of the situation to get better. Still ahead on Delmarva Life, that's what one woman did. She was taking about a dozen prescription drugs a day. Then she decided to quit her extremely stressful job and get outside. Find out what happened when she traded in her skyscraper to become a landscaper.
And a little puppy's life changed when he started barking at something floating in the sky. You're going to hear the story of how a romantic hot air balloon ride became his ticket to a better life. Delmarva Life will be right back.